This is Tanya Stansel from Health Education Services. We will be discussing lupus. First, a disclaimer. This video is solely for educational purposes. It is not meant to treat or diagnose any condition. Lupus is an autoimmune disease that affects the entire body. The immune system attacks both tissues and organs within the body, causing inflammation. Parts of the body that are affected include joints, skin, kidneys, blood cells, brain, hearts, and lungs, among others. There are four types of lupus: systemic, cutaneous, drug-induced, and neonatal. Systemic lupus makes up 70% of cases and involves a major organ in about half of the cases. Cutaneous lupus involves the skin and makes up 10% of cases. Drug-induced lupus is caused with high doses of some medications and make up 10% of cases. It can diminish after the medication has been stopped. Neonatal lupus occurs when the antibodies of the mother impacts the fetus, causing symptoms at birth that subside within 6 months. There are approximately 1.5 million people in the United States diagnosed with lupus and is more common in women of childbearing age. 90% of those diagnosed with lupus are women. The most common age range for diagnosis is between 15 and 44 years old. Of individuals who have lupus, 1 in 3 have also been diagnosed with another autoimmune disorder. Lupus is more common in women of color. African American women have a 2 to 3 times higher prevalence rate than white women. Genetics plays a role in developing lupus. Genetic variants can impact both who develops lupus and how severe it is. There are several symptoms that someone with lupus can experience. They include fatigue, fever, joint pain, joint stiffness, joint swelling, butterfly-shaped facial rash, photosensitive skin lesions, Raynaud's phenomenon, shortness of breath, chest pain, dry eyes, headaches, confusion, memory loss, hair loss, and swollen glands. There are several tools clinicians use to diagnose lupus. Lupus can be mistaken for other diseases, so it's important that certain tests are completed. When considering lupus, it is important to complete a medical history, a complete physical exam, blood tests such as complete blood count, erythrocyte sedimentation rate, liver and kidney tests, and anti-nuclear antibody tests. Also, skin biopsy, kidney biopsy, and a urinalysis. There are complications that an individual with lupus can experience. They include skin scarring, heart attack, joint disformities, bone fractures, kidney failure, cataracts, avascular necrosis, pregnancy complications, cardiovascular disease, headaches, dizziness, behavior changes, vision problems, and seizures. Once diagnosed, there are treatments that can be used to control symptoms. Currently, there is no cure for lupus. Because lupus affects many symptoms in the body, it is often required to see a team of doctors, including a primary care physician, rheumatologist, and others as needed. Medications used include nonsteroidal anti-inflammatory drugs or NSAIDs, antimalarial drugs, corticosteroids, biologic immunosuppressants, rituximab. These drugs are used to decrease swelling, decrease pain, prevent flares, and decrease damage to joints. There are lifestyle changes individuals can make to help cope with their lupus symptoms in addition to their treatment. Having regular checkups is important to prevent flare ups. Wearing sun protective items such as hats and long sleeves and using sunscreen is important. Regular exercise and a healthy diet are also important. Smoking can increase the impact of lupus on the cardiovascular system, so not smoking will help decrease the effects of lupus on the heart and blood vessels. Thank you for watching our video. Subscribe below and visit our blog at healthylivingforyourself.blogspot.com.